My upper teeth are crooked, and then the teeth next to them are behind.
This is what your new smile's gonna look like.
Wow!
Then,
My husband was like, no pandemic and no smile is gonna stop this love.
that's coming up. Our next guest, Genevive, a bride-to-be, was on our show 3 years ago to begin a complete smile overhaul to get ready for her big wedding day. Take a look.
I would say I have issues with my teeth around 4 or 5. My upper teeth are crooked, slanted, and then the teeth next to them are behind them. I don't want this small part of me to stop me from living. It's hard because I'm like, this has bothered me for years. Like, I always wanted to have a great smile.
The question is, what do you see, Dr. Bill?
Well, I see the beautiful, confident woman, too, who will be a lot happier with a big, beautiful smile.
Yes.
So with a team of dentists, and you're gonna have like a team of dentists to try and fix this, it could be done. And I'd like to tell you that we'd be honored to treat you as a patient in our practice and give you the smile that you dreamed of.
When Dr. Dorfman came to me and asked me if I wanted to work on one of the hardest cases he's ever seen, I said, sure, bring it on. And then I looked at it and I thought, oh my God, I've never seen anything like this. So here you can see she's very V-shaped. And ideally, we wanted to get to an arch that looked like this. What we wanted to do was use Invisalign and build in micro movements, tray to tray, to allow me to reshape the bone so we could straighten the teeth. And that'll give the best result with the veneers at the end.
Here we are today. I get to put the icing on the cake. We're going to put 8 porcelain veneers on our upper teeth. Let's get going. This is the last time we have that funky smile. All right, listen me up.
We're gonna do a mock-up now,
All right.
which is a guide for the laboratory as to what we want your teeth to look like.
Okay.
Some of these teeth that stick out a lot, we're just gonna reduce back a little bit. What I'm gonna do now is make your gums all even with a little laser.
Oh, okay.
Now, we're going to add resin to your teeth so I can shape them. Okay, open up for me. Going to do a mock-up on this guy here and make it look like the one next to it. We use this to kind of mold and sculpt her teeth. So this is the most challenging tooth because it's way, way, way far back. When we started, this guy was almost in your palate. Okay, Genevieve, this is pretty close to what your new smile is gonna look like. Take a look.
Oh, wow!
And these are just temporaries. Wait till you see the permanent ones. It's gonna be even better.
Oh my God. Dr.
Well, joining us now is Genevive and the dentist who made it all happen, Dr. Bill Dorfman. Welcome, you two.
Welcome.
Thank you.
Thank you for having me.
All right, Genevive, let's see that new smile. Wow.
Wow.
Oh, my goodness.
Oh, my gosh.
What do you think, Genevive?
I am in awe, honesty. Honestly, sorry. I'm in awe. I would have never imagined this in my wildest dreams, honestly. I just can't believe we went from that to this.
My goodness. Genevieve, how does it help you feel?
I mean, I feel amazing. Like the confidence has truly been restored. You know, your smile is the first thing that greets people, right? So like, it's hard, especially in my industry. I'm a costume buyer. You know, I have to talk to people. I'm out shopping and things of that nature. And now I just have the perfect smile with the perfect personality.
Your smile is the thing that tells the world who you are, right? That's the first body language cue we see.
And now you don't stop smiling, which I love it. We'll be back with more on this right after the break.
My upper teeth are crooked, slanted, and then the teeth next to them are behind them. This has bothered me for years. Like, I always wanted to have a great smile.
We'd be honored to treat you as a patient in our practice.
Wow.
And give you a smile that we dreamed of.
Okay, Genevieve, this is pretty close to what your new smile is going to look like. Take a look.
You know, back then, Genevieve, you were a bride-to-be when you were originally on the show. You got married in 2020. Congratulations.
Thank you.
So happy for you.
We decided to keep our original wedding date. My husband was like, no pandemic and no smile was going to stop this love.
So happy for you.
Thank you.
I mean, coming to you, Dr. Dorfman, I mean, we've seen you do major transformations, but this has to be up there. Tell us why this was particularly challenging. Walk us through the process.
Well, okay, Genevieve came in and said, Doc, I'd like porcelain veneer. Like, are you kidding? I mean, she has the most jumbled teeth I've ever seen in my entire practice of dentistry. I said, I just can't put veneers on these. So it literally took 3 dentists and 1 lab to make her smile. The first thing I did was I sent her to Dr. Monica Madden. Dr. Madden is an orthodontist. She put Genevieve in Invisalign for 3.5 years to straighten out her teeth. Now, once we got them straight enough for the veneers, we were happy with the orthodontic result. Something happened that doesn't normally happen. She got this recession on her 2 front teeth. If I had put veneers on her at that time, her 2 front teeth would look like beaver teeth. So Dr. Ziv Simon to the rescue. He's our periodontist. He did a gum graft. We grafted gums over those 2 front teeth. It was unbelievable. So he brought the gums back, and then I was ready to do the porcelain veneers. We did 8 beautiful Da Vinci veneers to finish off her smile, and it was miraculous. Like, I'm sitting there putting these on, and like, I had tears in my eyes. I never knew it would look this good.
Dr. Dorfman, I can't imagine how rewarding a process that was for you and your team, and also for Genevieve. So, Doc, how would you describe Genevieve's teeth before the process started?
Well, I mean, the technical term is a severe malocclusion. In lay terms, she just has jumbled up teeth, okay? And, you know, typically if somebody has slight rotations, we can fix that with porcelain veneers. That's really easy to correct. There was nothing slight about her rotations. I'd like you to show the picture. We actually had teeth in her palate. Like, if you look at it's called an occlusal view, you can see she had teeth in her palate. We could not put porcelain veneers on those. So it was really a challenge and an honor to work with, you know, Dr. Madden, the orthodontist, you know, Dr. Ziv Simon, the periodontist, and then of course, Da Vinci Dental Studios always brings it home for us. So I'm thrilled and honored to be a part of this. And I know that now Genevieve feels like she's really her best self.
Genevieve, as you can see, we're all beaming because we're so happy for you. Let me ask you, is there anything you'd like to say to Dr. Dorfman?
Dr. Dorfman, I love you. You are the best in Los Angeles. I have been referring and referring and referring because you make dreams come true.
Oh, thank you so much. You know what? Same back to you.
Well, we're so happy for you, Genevieve, so happy that it turned out so great. And as always, Dr. Dorfman, you do not disappoint. Great job. Congratulations to both of you.
Thank
you. Thanks for the opportunity.
All right, best of luck. Much more right after the break.